If you are living with Sjogren's and you are doing everything right, you're managing the dryness, you're taking your medications, following your rheumatologist or immunologist advice, but you still feel like your body is stuck in this cycle of inflammation and exhaustion, this video is for you. Because what I'm about to share with you today could be the missing piece that explains why you're still struggling despite your best efforts. Hi, my name is Dr. Wada, and today we are talking about the hidden inflammatory driver that affects up to 60% of those of us living with Sjogren's disease, but almost no one is talking about it. Let me paint a picture that might sound familiar to you. You wake up feeling like you didn't sleep at all, your joints are achy, your energy is non-existent, and that brain fog makes even the simplest tasks feel frankly overwhelming. You think, okay, maybe I'm having a Sjogren's flare. So you rest, you hydrate, you take your anti-inflammatory medication, but the days are going on, the weeks are adding up, and you're still feeling pretty terrible. Here's what's happening to most people, and unfortunately, many healthcare providers and professionals miss. Your immune system isn't just attacking your salivary glands and your tear glands. It's also oftentimes become hypersensitive to things in your environment that shouldn't be threats. This creates what I call the inflammatory snowball effect. Your autoimmune condition makes you more reactive to allergens. Those allergic reactions trigger more inflammation, and that inflammation makes your Sjogren's symptoms worse. And around and around and around we go. And the result is we end up stuck in a cycle where we are constantly fighting fires instead of preventing them. Now, here's the part that might surprise you. Recent research shows that people with autoimmune conditions, and especially people that have Sjogren's, have immune systems that oftentimes are primed for allergic reactions. You want to think about your immune system like a security guard or a bouncer. In a healthy person, that immune system is able to tell the difference between a real threat, like a virus, a sting, an infection, a bacterial infection, and something harmless like pollen or pet dander or a peanut. When you have Sjogren's, it's like your security guards are on high alert all the time. They're jumpy, they're reactive, and they start treating everything like a potential threat. And so when pollen comes around, or dust mites, or the dander from your puppy dog, your immune system doesn't just react, it overreacts. And this isn't just theoretical. Studies have shown that people with Sjogren's have significantly higher rates of atopic or allergic diseases, allergic rhinitis, that's hay fever, asthma, food sensitivities, and even allergic reactions compared to the general population. But here's the kicker. Most of us aren't connecting the dots. We're treating Sjogren's over here, IBS over there, we're popping some Benadryl or some Claritin or Allegra, and we're not really realizing that they're all part of the same inflammatory storm. So how do we know if what we're experiencing is a Sjogren's flare or a significant allergic reaction? And really, this is crucial because the approach to managing each is very different. A typical Sjogren's flare might include increased dryness, joint pain, fatigue, feeling like your body is off. And these symptoms tend to build gradually, or frankly, sometimes can come about overnight, and they can last days to weeks. An allergic reaction, on the other hand, often has specific triggers and patterns that you might notice. Symptoms that worsen during certain times of the year, reactions that happen in specific environments, your bedroom at night, office, when you're around a cat, when you're normally not around them, and symptoms improve when you're away from that trigger environment. Nasal congestion, postnasal drainage, or that feeling of mucus dripping down the back of your throat, sinus pressure that seems disproportionate to your other symptoms, and skin reactions like hives, eczema flares, unexplained itching, all may have some root in allergy. But here's where it gets really tricky. These two things can feed off one another. Significant allergic reaction can absolutely trigger a Sjogren's flare. And when your Sjogren's is active, you might be more likely to react to allergens that normally wouldn't bother you. You can become more sensitive and irritated by those allergens. I see this in my practice all the time, As a practicing allergy immunology doc, I am used to seeing folks with itchy, watery eyes, runny, stuffy noses, asthma, sensitive airways, hives, all of these things, right? And a patient will, and because of my, being more vocal about my own experiences with Sjogren's, I see a lot of Sjogren's patients as well. Not typical for an allergy immunology doc. So when I see that patient that has Sjogren's, they're having a really terrible flare, and it happens to be the middle of April or May in the Midwest, we dig deeper, we figure out that, oh gosh, maybe it is the tree and grass allergen that's really thrown lighter fluid on the situation. Or maybe it happens a few weeks to a month after a new pet joins the family, or there's construction nearby. It's getting that detailed history that can be really helpful and critical at teasing these things out and deciding what those next best steps are. Now, you might be thinking, okay, so what? I have allergies. I just take some over-the-counter medication. I call it a day. And look, I'm not against antihistamines. I recommend them all the time, all day, every day, essentially. They have their place. But when you have Sjogren's, simply putting a Band-Aid on the allergic symptoms with over-the-counter medications often is a bit more like using a Band-Aid on a leaky pipe. And here's why. Most over-the-counter medications are designed for people with fairly normal immune function. They're meant to provide temporary relief from occasional exposure to those allergens. When you have an autoimmune condition, several things are different. First, your allergic reactions may be more intense. They may last longer. You already have a baseline level of chronic inflammation going on. And so that dose of Claritin that works really well for your neighbor may not work as well for you potentially. Second, you're often dealing with multiple allergens at once. Maybe not just tree pollen and spraying, but it's tree pollen, dust mite, kitty cat, grass, in addition to irritants from whatever cleaning products you're using. Third and foremost, and this is the real big one, those ongoing allergic reactions are adding fuel to the autoimmune fire. They're adding to that whole body burden of inflammation. So even if that antihistamine reduces your sneezing and your congestion, it's not addressing the underlying inflammatory burden that's making your Sjogren's harder to manage. What you need is a comprehensive approach, identifies your specific triggers, reduces your overall allergic and inflammatory load, and helps calm down the hyperactive immune response. So what does effective allergy management look like when you have an autoimmune condition? First, it starts with proper testing. And there are two ways that traditionally allergists use to check for true allergic responses. One are those skin prick tests, work very well. They do typically require you to stop many of those medications, and actually some of the medications we often will use to tackle some of our Sjogren's symptoms. And so I often actually rely a little bit more on blood work and blood allergy testing than I did when I initially started my practice. In part, I have a patient with chronic hives that we don't want to take them immediately off of all their antihistamines, other things going on. Blood work is actually really good at helping tease out, what is true allergy and what might be an irritant trigger, something that looks and acts and feels like allergy, but is turning on those cells in a slightly different way. More on that in a future episode. Second, it involves creating a personalized management plan. It might include environmental modifications, using air purifiers in those targeted spaces, targeted treatments, and yes, sometimes medications too, but the right medications at the right doses, keeping in mind that many of these medications and their side effects can add to the issues we already experience with Sjogren's. Antihistamines are drying. Nasal steroids may be irritating to the nasal passageways. Many of them contain alcohols as part of the formulation, and that can be drying to the nose. So it can be a really delicate balance to help calm inflammation and also not add to that dryness and irritation that already is a hallmark of Sjogren's disease. Third, and this is where it gets really exciting and I start to nerd all out, but we're looking at treatments that don't just manage allergic reactions, but actually help retrain your immune system to be less reactive over time. And I'm talking about approaches like intralymphatic immunotherapy, or ILIT for short, which helps us achieve the same results as years of regular allergy shots in just 3 visits over 8 weeks. We're also talking about targeted biologic medications that really hone in on the root of what is driving some of that inflammation, whether it's allergic flavor inflammation, whether it's Sjogren's related inflammation. We have those medications that are now, many of them in phase 3 clinical trials and are having really great results. So more to come on that. And really thinking about a comprehensive environmental medicine-based approach to address that perfect storm of causes that lead to increased immune hyperreactivity. The goal isn't just to reduce your sneezing and your congestion, though we do want to do that too. The goal is really to lower your body's overall inflammatory burden so that you and your Sjogren's becomes more manageable, your energy improves, and you can actually start to feel like yourself again. I want you to know that if this resonates with you, you are not imagining things. The connection between autoimmune conditions and allergic hypersensitivity is real. It's documented in the medical literature, and it is something that more and more specialists are really recognizing and giving more attention to. I can't tell you how many patients have said to me, I've always felt like my allergies were somehow connected to my autoimmune flares, but no one ever took me seriously. Well, I'm taking you seriously. And the good news is that when we address this piece of the puzzle, patients often see improvements, not just in their allergic symptoms, but also in their overall autoimmune management. Better sleep, more energy, fewer and flares that don't last as long, and an overall sense that their body isn't constantly fighting against itself. This isn't about false hopes or miracle cures. It's really about taking a comprehensive, evidence-based approach to medicine that looks at your body from that whole perspective instead of treating each symptom in isolation. So if you want to learn more, here's what you can do. First, start paying attention to patterns. Keep a journal for the next few weeks and as the seasons change. Note your symptoms, energy level, what's happening in your home environment. Are your worst days on high pollen days? Do you feel worse certain times you're spending in rooms in your house? Do your symptoms improve when you're away from home, when you go on vacation, or do they get worse? This information is gold when it comes to helping us think about and identify specific triggers. Second, if this video has opened your eyes to the possibility that allergies might be contributing to your Sjogren's symptoms, consider talking to your healthcare team about allergy testing. Not every doctor will make this connection automatically, so you might need to advocate for yourself. Third, subscribe to this channel, turn on the notifications, because our next video, I'm going to dive deep into what the future of allergy management looks like for our autoimmune patients. We're talking about cutting-edge treatments like ILIT, that interlymphatic immunotherapy that can revolutionize how we treat allergies in just 3 quick treatments, how to find the right specialist, and real patient success stories. I'm also going to share some specific environmental modifications that you can start implementing right away, even before formal testing is done. Look, managing Sjogren's is challenging enough when we're not having to deal with the added burden of unrecognized allergic reactions. But when you understand this connection and address it properly, it can genuinely be life-changing. Speaking of life-changing, if you're tired of feeling alone on your Sjogren's journey, I want to invite you to something special. I'm hosting the 4th annual Virtual Sjogren Summit, July 17th through the 19th. This year's theme is building your Sjogren's network, because navigating this condition shouldn't be a solo journey. It's not just another webinar. It's 3 days dedicated to connecting our community, sharing practical strategies, helping you build your team of doctors, peers, and supporters. We're going to dive deeper into topics like allergy-autoimmune connection, like we discussed today. We'll have sessions on managing fatigue, advocating with your healthcare team, and so much more. Live access is completely free. You can register at the description below. Drop a comment below. Let me know. Have you noticed a connection between your allergy symptoms and your autoimmune flares? I read all the comments, and your experiences really help inform the content I create. So thank you for watching, and I will see you in the next video. In the meantime, take care.